Today's presentation will be on calcium. We will focus on the key features, major functions, different food sources to receive calcium, diseases associated with or deficiencies, foods to select and prepare, and risk of supplementation. What is calcium? Calcium is the most abundant mineral in your body. Calcium helps keep your bones strong, your muscles moving, your blood clotting, and your nerves sending signals. Why do we need calcium? Calcium is a nutrient that all living organisms need. The main source of calcium comes from dairy products, green leafy vegetables, nuts, seeds, and fortified products. Calcium is essential for several important functions in the body. The first one that it's important for is bone health. Calcium is a major component of bones and teeth, providing strength and structure. Having enough calcium intake during childhood and adolescence is crucial for building strong bones and preventing osteoporosis later in life. Muscle function. Calcium is involved in muscle contraction. When a nerve stimulates a muscle, it releases calcium, allowing the muscle to contract. Nerve signaling. Calcium ions play a role in transmitting nerve signals throughout the body. They are involved in the release of neurotransmitters, which are chemicals that transmit signals between nerve cells. Blood clotting. Calcium is necessary for the process of blood clotting. It is the cofactor for several enzymes involved in the clotting cascade, which helps prevent excessive bleeding when we are injured. Cell signaling. Calcium ions are used in cell signaling, controlling various cellular processes. And lastly, enzyme activation. Calcium ions serve as activators for many enzymes, allowing them to perform specific chemical reactions in the body. This is why we need calcium. What are the food sources for us to get calcium in our bodies? Here is a list of some of the foods and drinks that you can get for calcium. We have sardines and canned salmon, seeds, beans and lentils, milk, whey protein, cheese, almonds, rhubarb, and yogurt. How much do I need? Well, it all depends on how old you are. So here's a chart to kind of explain to you how much calcium each person needs based off of their age. So anywhere between 0 to 6 months old, up to 71 years and above. So being the most as you get older, you'll need 1,200 milligrams. And then noticing the difference at 51 and 70 years old, 1,000 milligrams for males and 1,200 milligrams for females. What is calcium deficiency, or what if you're lacking in calcium? The following conditions or lifestyle habits may result in low calcium levels, also known as hypocalcemia. These are just a list that I put on here for all the different things that may cause you to have a calcium deficiency. So if you want to take a look here, bulimia, mercury exposure, overconsumption of magnesium, long-term use of laxatives, prolonged use of some medicines, like chemotherapy, chelatation, therapy used for metal exposure, lack of parathyroid hormone, people who eat a lot of protein or sodium may excrete calcium, some cancers, high consumption of caffeine, soda, or alcohol, some conditions such as celiac disease, inflammatory bowel disease, Crohn's disease, and some other digestive diseases, some surgical procedures including removing the stomach, kidney failure, pancreatitis, vitamin D deficiency, and phosphate deficiency. So here is a list. Most of these things are probably some things that you've maybe heard of. Hopefully you haven't had to experience any of these calcium deficiencies. So here are some calcium supplements and where you can hopefully just understand what you would need to do if you were needing supplements. One of the facts here, according to the ODS, around 43% of all adults in the United States take calcium supplements, including 70% of older females. Taking supplements can increase your daily calcium intake by about 300 milligrams of calcium a day on average. Check first with your doctor whether you need supplements and follow these dosages that the doctor recommends. Take the supplements with food for best absorption and to minimize possible adverse effects. Consume the supplements at intervals, usually 2 or 3 times a day. So make sure when you're taking these supplements that you follow the requirements for how and when to take them. What are the different types of supplements? So here you have your calcium carbonate, calcium lactate, calcium gluconate, and calcium citrate. What are some of the risks that come along with taking these supplements? It's better to obtain nutrients from natural food sources, although sometimes it's not possible to get enough in this way. So therefore, we do have to take supplements, but there are some side effects that may come along with it. One of them include gestational issues. Different calcium supplements may have less side effects. So going back to the 4 different ways here, you can maybe change which calcium you are intaking to see if it does affect you a little bit differently or have different side effects on it that might be less severe than others. High levels of calcium can cause kidney problems, calcification of soft tissues and blood vessels, kidney stones, and constipation. It may interact with other drugs. So do know that if you are taking calcium, to separately take these from like any antibiotics or any other drugs that you may be taking prescribed by a doctor. Things to consider when thinking about calcium and if it's the best fit for you. Make sure that you are getting most of your calcium from dietary sources, but if you are needing to supplement your calcium intake, check with the doctor first. Resources come from Medical News Today, and here is the website where this information can be found. Thank you.